So class, how should we go ahead?
Doctor, I think we can just proceed.
Okay. Dr. Azhar, please proceed.
All right, okay. Just share my. Can you all hear me well?
Yes,
Yes,
Doctor.
Doctor.
Okay, because I'm
Cannot hear.
tested my microphone just now. It wasn't that clear. Right. Okay, so hi everyone. For your clinical pathology rotation, you'll be seeing me in the afternoon after the swine rotation in the morning. So mine will be 2 to 5, and if you see this, that our activities would be measuring packed cell volume, measuring plasma protein, and also making thin blood smear. Um, you normally we would have students to do some differential white blood cell count, but due to time, and we can do this another time. So we'll have you observe the morphology of the white blood cells instead under the microscope, right? And the whole time you will be monitored by me. The clinical pathologist will be me, and also the lab staff as well. Due to a space constraint and to abide to our SOPs, we will only allow 6 students at a time. So you are, instead of combining 2 groups at one time, we will separate you into your own individual groups. So the first group will be 2 to 3:30, and the second group will be at from 3:30 to 5 p.m. Okay, you can see this. This is already I've already uploaded at the Ultra Blast. Okay, so this is according what was given. So I've divided you guys into 2 groups. Okay, so what I wanted to do is just to make sure that we have, because this will be the first time you ever enter our lab, so it might take a while for you to get accustomed with the lab and where you should be and where you should not be. So try to be there 5 minutes, okay? 5 minutes before your turn, okay? And to make things easier for all of us, please watch the link that I've shared with you before as well. This link, these 2 links, so that when you enter the lab, you're pretty much know what needs to be done in the lab and what samples you need and everything. Okay. And most importantly, you need to practice good social distancing, and please wear your face mask all the time. Do not wear on your nose or on your head, because there are some students do that sometimes, thinking that you don't have to worry about on friends. But please do wear your face mask at all time, and wear your lab coat and also covered shoes. Yeah, that's part of the protocol of entering a lab. Okay, so the activities are just 4, but it will take a while for you to get used to handling the um, doing the technique itself. Initially, we would I think we will demo for you how to do it at the site. But again, like I said, please be well prepared when you enter the lab. That means I want you to watch the videos first, so that it will not be a foreign thing for you when we start demo the technique to you. And please be aware of the units as well. I will question you on the units that needs to be reported in your how we report it in our lab results. And also, if we have time, I will look at the first group first this next week. If we have time, like half an hour or 50 minutes at least before the next session or before end of your session, we will have a case study discussion, just a brief one, not as lengthy as we did during our um, LI. Okay, so just try to do it as yeah, as quickly but as efficient as possible. Okay. Um, yeah, I think that's pretty much, Dr. Chen. I don't have anything else to say. Do any students have any questions? 5 minutes. No questions?
I think no from us, Doctor.
Yeah, it's pretty clear, isn't it?
Yes.
So I emphasize again, be there 5 minutes before your turn. Not in the lab, but at least in front of our lab. And then please enter using the door, the back door, not the front one where our diagnostic work is going on. The back door, I mean not the back door, the first door will be next to the immediate one next to parasite lab, parasitology lab. Okay, so you enter through that lab, through that door. Okay, right. So that's pretty much that's it. Done already, Dr. Chen.
Oh, hi, Dr. Azalia, you are done?
Yes, yeah, I am.
Okay, so maybe we can go to the next briefing for the small animal clinic rotation. Okay, I'm going to share screen. All right, student, can you all see my screen?
Yes, Doctor.
Can, Doctor?
All right. Okay, let's start. So I'm actually quite excited that you're going to come back to have these face-to-face rotation practicals. So for small animal clinic, all right. So I will be sending this instruction later on after I finalize and I put them in the Putra Blast. So let's go through these instruction first. They are quite a bit. So do stop me if there's anything not clear in between, then I can explain further. So for clinic, communication is the key. So this is the first time that you're going to come into the clinic. So these are your the expectation that we have for you all. Like you all must demonstrate these abilities, describe the procedure in the clinic from registration to discharge, how patients are being registered, what forms are being used to fill up, like the patient medical records, and then look at the flow of work in the management of case as an outpatient, and what is the flow if they are admitted. 2, you learn about organizing a clinic consult. So because this is your first time entering the clinic and it's only one day on Thursday, the whole morning from 9 to 6, sometimes 5 if the cases end earlier. So what you all need to, these are the 4 key things that you all need to learn. So first, observe history taking, and then try to take history on your own for at least one case. But most of the time, because this is your first time entering, you observe first. Maybe by the afternoon, you can try to take history for one case. And then help in restraining animals. So be proactive. You will usually go and enter the consultation room together with our vet assistant. So you can help them with the assisting them with the restraining of animal. And then when you have chance, you can perform physical examination. And then finally, identify abnormal system and any general systemic changes. Also, third one, observe sampling method for diagnostic workup. So I know what type of test is required. So try to listen. Are we taking blood samples, skin samples, cytology and all that. Number 4, you are expected to know how to do calculation and preparation of drugs. Then number 5, know about preventive medicine. So this one should be at your fingertip. Like the vaccination, what are the ectoparasitic control, endoparasitic control, and neutering. Finally, familiarize yourself with the hygienic practice of the clinic. Note how the equipment like thermometer, stethoscope, examination tables are being cleaned and disinfect after each session. So you are expected to help out with the cleaning of the consultation table, or if you're using trolley to transport the patients, maybe to radiology and all that, you are expected to help to clean up the trolley as well. So ask our vet staff, our clinic staff on how to do the disinfection. So your rotation day is on Thursday, 9 to 6. Come to UVH Small Animal Clinic. There will be attendance taken twice, one in the morning at 9 and then after lunch at 2. For attendance, you need to report to Puan Munira. Later, I will show you how they all look like. I want to help you to recognize the UVH clinic staff. So I'm coordinating for your this small animal clinic for your 4th year. And then other academics involved are Dr. Malaika, Dr. Gayatri, Dr. Ko, and Dr. Intan, and all the other clinic staff. Your attendance is compulsory. 100% attendance is required for this rotation. So if you are sick, make sure you call in to inform. And when you return, immediately submit your sick leave certificate to Puan Munira. Do not give that certificate to academics. Okay, so hand it to Puan Munira. Medical certificate must be produced by our Pusat Kesihatan. So you will be allowed to replace what you miss at another suitable time if because of you are called in sick. But if you are absent for other reasons, please submit a written letter or email to the teaching academic on duty and tell what's the reason for your absence, and then we will consider about replacement. If you know that you will not yes, so it's the same thing. So replacements is not your prerogative if you find out that it is not a valid reason for why you are absent. For the schedule, on the Thursday, 9 a.m., please see Puan Munira and sign attendance. Consultation at clinic usually start around 8:15 to 8:30. So make sure you're coming prepared with tidy clothes, lab coats, and then learn how your ethics and communication. So look for Puan Munira or Dr. Widato for briefing, or any VO that come in earlier for briefing, because this is your first time coming to the clinics. Maybe you all need to be briefed on where are the records being placed, which consultation room to enter, how to enter. You're going to enter with, for this first time, you're going to enter with our veterinary assistants. And then there is this group rubrics that you need to, rubric A, that you need to submit to Puan Munira, the VO and the UVH staff. And then rubric B is to submit to the academic on duty. So after the briefing, when you're ready, if you see there's a file coming in and you plan to attend to the case, you can read the file first and then be aware of the reason why the patients come in. Look at the patient's signalements, client names, and history of past visit. Then when you're ready, our vet assistant or our assistant veterinary officer will actually, you go in with them and then they will introduce you to the client as a student. Or if, let's say, the AVO, the vet assistant say that you may enter now if they trust you, so you have to introduce yourself properly. Why are you here? So introduce yourself. We are from the 4th year student. We are coming in for our clinical rotation and we will be observing our clinician consulting on your case. So it's more on observation. So you all are not the one that start the consultation and taking history. So your main job is to observe and take notes how clinician take history and conduct thorough physical examination. So when allowed, and then maybe the clinician asks you and give you the opportunity to do the physical examination, take the opportunity and initiative to do the physical examination when you are allowed to. So when I say takes note here, don't be a reporter in front of the client, take down a notebook and then start writing. So some client, they don't like it. It's look like you're being like a reporter. They might be upset. So do it subtly or away or not directly in front of the owner if you want to take notes. Okay, or you take notes after the end of consultation rather than during the consultation. So during the consultation, make sure you're focused on what is the conversation, the communication, how it takes place, rather than busy taking notes or write down notes. So far, am I clear? Are you all okay? Are you all following?
Yes, Doctor.
Yes, Doctor.
All right. And then I think you all can read here. You need to determine which body system are affected, what are the differential, and suggest the tests for further workup. So you can read all these in the instruction that I'm going to put it in the Putra Blast later. So, but I want you all to pay special attention to all the cases that has preventive healthcare practice like vaccination, ectoparasitic control, endoparasitic control, and neutering. So these are the main focus for this first clinic rotation during your first semester. Okay, here comes the don't. You are not allowed to give your opinions to the client at any time unless instructed by the clinician. So if the client keep asking you, maybe so happen clinician is just out of the consultation room and you are with the client, reply them and say that the veterinary officer or the clinician will discuss the finding with you. So don't give any opinion. We do not want to cause unnecessary worry and grief to the client. And you are expected to be well dressed and equipped for this rotation. If you fail to comply, you shall be excused from the clinic and your attendance for that day will be cancelled. So let's say you so happen after the consultation, you actually help to restrain a cat and the cat is nervous, got a lot of hair shedding. So hair all stuck on your lab coat. So you look at your lab coat, it's dirty, not tidy, there are a lot of hair stuck there. You can actually go into the clinic where all the vet assistant or VO are writing their cases. There is actually this sticker for hair removal. Borrow from them, clean yourself out before you go in for the next consultation. Always check yourself tidy and clean all the time. Okay, for evaluation part, so rubric A, it will be evaluated by our BO and our VH staff. So it's about your social communication skills and attitude. You'll contribute to 10%. Rubric B, so this will be evaluated by the academician on duty. So even let's say we are not there, we will come back and discuss with our clinic staff, our VO and our assistant VO to find out how you are doing on your social skill, communication skill, your attitude, and your clinical proficiency. So all these will contribute to 50%. Then I will collect your CPP book, submit to me before 5 p.m. on the Monday after the week of rotation. That will give you 5%. And you all will also have a poster assignment. I would like you all to do a group assignment to produce a digital poster. This poster is actually like a client handouts. So I will give you a separate instruction later and a title on what title to be assigned to each group. Again, I'm stressing on about the preventive healthcare like vaccination, deworming, ectoparasitic control and all that. So this poster, you can do it in your PowerPoint form, either A4 size or A3 size, and then you submit it in group to me before 5 p.m. the Monday after the week of rotation. I will give you a Padlet link as well to actually post it on the Padlet so that you can share with all your classmates, as well as email to me. So you send 2 copies, one email and one to the Padlet. Finally, there's a quiz on Putra Plus. I will only open on the coming next Thursday onwards. It will be open up to the end of week 14. So this quiz, you can do it multiple times. This is actually to give you an idea, a basic fundamental knowledge that you need for your clinic rotation. What is necessary for you to know, like calculation of drug, fluids, the basic preventive healthcare. So this quiz is actually like a background knowledge for you all. So try to attempt to the quiz before you're entering the clinic. So that will contribute 25%. All in all, give you 100%. There are 5 reasons for automatic failures. If you don't, your attendance is not 100%, that means that one day you did not come, gone. If we caught you giving opinion, talking to clients without permission, automatic failure. If we catch you duplicating, photocopying, or take photo of the UVH document, automatic failure, because you're not allowed to remove any UVH document. Is private and confidential, PNC. So you're also forbidden to actually upload any photos of clients, patients, procedures, forms, records under UVH on the internet. No, don't post it on anywhere. No Facebook, no Instagram, any social media. They are all confidential. We will also have automatic failure for any plagiarism, failing in professional attitudes towards client, patient, and staff. So always be professional. Don't be rude. Yes, act professionally with good attitudes. And finally, there's a instruction for DVM 4 and 5. This is a long instruction about rules and regulation during your clinical rotation. Dr. Malaika later, after me, will go through this with you in details. Okay, so aside from this, I want to introduce you all to UVH clinic staff. So I'm going to share another screen. Do you have any questions so far? Am I clear?
Yes, Doctor.
Yeah, doctor.
Dr. Chan, I got question.
Dr. Chen, yes.
Okay, so you write there on Thursday, the consult start at 8:15 a.m. What time are students expected to report to Puan Munira on Thursday?
Okay, actually not usually Puan Munira and Dr. Vida, both of them come in around 9 a.m. because of the flexible hours. They come in slightly late. So in that case, you all will be expecting to start at 9 instead. So because we have to wait for the staff, the assistant or the vet, our clinician, before you all can start entering the consultation room. If they come earlier, you enter earlier by 8:30 when the case file is ready or being registered. So all depending on what time, how long you all take for your briefing, and what time Puan Munira and clinician come in. So the latest you all start by 9 a.m.
Okay, I just want to have something to add.
Yeah.
Next week, most likely, so it will depends on the pathology group. They may have, like this week, they have not started rounds yet. So when they have pathology round, so all students are expected to attend round. So at this point, the round should be online. So so you can still be attending round and physically, if you are moving around, that's fine. But once they are going on physical, you are expected to be in the round. Okay, so so if that happened, then you cannot give excuse saying that I was asked to whatever and so on, because rounds is actually like it's expected. So if there are rounds, then you're expected to be in the rounds until it is finished, the pathology rounds.
Oh, I see, Dr. Chen. So the pathology round is on Thursday morning, up
Yes,
to 9 a.m., right?
depends. Sometimes it end early, so it depends on the rounds. But the allocated time is 8 to 9.
I see. So in that case, I will make amendment. So instead of putting there 8:30, maybe I'm not going to be that strict. Maybe the latest start by 9 a.m. instead, so that we won't have any like miscommunication with our clinic staff where they expect them to come early but they are not here. So I'll put there by 8:30 to 9 time range. Is that all right, Dr. Chen?
I suppose so. Should be okay. Yeah. So make it actually like a standard time lah. Then it's easier for
Yeah.
everybody. Mm.
All right.
But would it delay? Would it? I mean, I'm not sure how long is the briefing at 9. Would it delay?
Officially, briefing will just take maybe 5 minutes to 10 minutes
Ah,
the most. Yeah, so the official time to start is actually 9 a.m. anyway. 9 a.m.
okay.
they are expected to take attendance. So 9 a.m. they have to be here.
Okay.
Yeah.
All right. Then the next question. So this is to the student. So if you are asked by any clinician and say, oh, okay, please actually like all your seniors. So that case is very interesting. So can you please take a snapshot of the findings or the lab results and WhatsApp it to me? Can you do that?
Can, Doctor?
Can.
Yes.
So Dr. Chan have to answer then. Is it can? So
So
they need to take a photo of, I don't know, lab result or the whole PE records.
so that is considered like P&C document, UVH document, right? So by right, if it's just to send to Dr. Chen, after that, by right, you have to delete it. You're not supposed to keep them, and not supposed to post it anywhere on social media. It's just for Dr. Chen only. Yeah. Okay, so I forgot to add on one thing because this clinic rotation on Thursday is just one day. So the discussion with the group discussion with academics is not compulsory, but y'all can actually email your academics on duty to see whether do you all want a group discussion or is it necessary to meet up. So email your academics on duty for that week and find out are you all going to have group discussion or not. But this group discussion is actually optional. If so happen like I'm the academic on duty, I'm working on the clinic on that day, I get to see you all during the rotation. So I will consider that one as done because I will go and check on in your clinics how you're doing. So then I won't do a separate group discussion. So it's based on individual academics, whether they want to do it or not. It's not a compulsory for group discussion. But your better email, do discuss with your academics. What's your expectation? Okay. So here, I know this is your first time you're entering the clinic, and then sometimes it might be awkward. You do not know what are the things around the clinic and who are the staff. So I want to introduce you all to our clinic staff, like, so that you know how to call them and get them for help. Don't just stand there, Che or Puan, you do not know who they are. So want to reduce this awkwardness. So at least you find out, oh, now we're going to get to see them in clinic and you roughly know who they are and who you can get help. So just now, so in clinic, we have two permanent clinician, our permanent staff. Dr. Vidato, she's the Penyalaras clinic for clinic. So she's Dr. Vidato. So you might get a briefing from her. Or if Dr. Siti, she's around, you can also get briefing from her. So these are our two main clinicians. Of course, we have other clinician as well, but I don't have their photos over here. They are on rotation basis. But Dr. Vidato and Dr. Siti are fixed at the clinic. Then I mentioned so many times about Puan Munira. She is Puan Munira. She's the main person that you all need to report to and get your attendance done. So anything you're not sure, ask her. So she'll be one of the main assistant ABO that give you a briefing. We also have Puan Ani. Puan Ani, she got a lot of experience. So a lot of times she can guide you very well, but don't be upset if she scold you. If she scold you or she sound you, that means she's cared. She want you all to do better. So she's Puan Ani. So Puan Munira, Puan Ani. And then we also have Sheikh Aisas, all our ABO, and Encik Shahir. So you will see them around. So we also have our vet assistant, Puan Normala, Encik Amri, and Sheikh Basira. So you can also approach them to get help. Where are the things? I need to get vaccine from the fridge. Where is the vaccine? I'm going to help the clinician getting the vaccine vial or some injection. So ask all of them, our ABO, our VA, they all know, they all can help you. And then so happen, let's say you all need to go to the main pharmacy. There are staff in the main pharmacy. We have Puan Ika and Encik Alif. You might meet them, you might not meet them. Maybe in the second semester onwards, you might see them more. But this semester, you might not be meeting them, but just want to introduce to you. We also work very closely with our staff in the main pharmacy, Puan Ika and Encik Alif. So you want to ask about drugs, they know where is it, what's the ingredients. Sometimes you can ask them as well. And then we'll have staff in the mini lab. Mini lab is the place that you're going to go after you take some sample. Let's say you take a skin sample, cytology, impression smear, you need to get it stained, or you send your blood sample for mini lab to do. You will go to the mini lab, then you will meet either Cik Edwina or Encik Azizul. So call them nicely. Cik Edwina and Cik Azizul, we need help. We need to get this blood test done. We are sending this blood from who and who, our clinician, or we need to get this impression smear, a discrete staining. How can we do it, or can you help? So they are the staff in the mini lab. So as for y'all, I just want to stress on this. Y'all must be prepared. And always the keywords is being tidy, tidy, tidy. Always tidy. Tidy with your shirt, you are wearing a formal shirt or blouse. Tidy trousers, no jeans, no pants with holes. Wear clean covered shoes, no sandals, no open-toed shoe. Put on your name tag. If possible, embroider it, like sew it on your lab coat. Or you can wear those pin name tag, but a lot of time it came off. You better to have them embroidered on your lab coat, your name. So we always want to see who you are, and then the client will also looking at you. Oh, this is your name. So for girls, ladies with long hairs, tie them up. For Muslimah, put a plain and tidy hair scarf. For male student, it's optional to wear ties. If you have tie, it will look more tidy and smart. And because we are still in our COVID, everybody have to wear facial mask. So double mask if you are wearing the normal facial mask plus the cloth mask, then you do double mask. With the KF95 or KN95, you can wear it just a single one. And then be prepared with your own, no sharing, your own stethoscope, own thermometer, pen lights, and stationaries. And here, this morning, I went to see all your seniors. I took their photos to give you an example how to be tidy and smart. So here they are wearing covered shoe, tidy lab coats. So they have their name tag. So I prefer not to have name stick using the Leukoplast, the sticky tape. Make sure you embroider it or you put a good name tag to see your name tag. So button up all your lab coat, no missing buttons, clean, no hairs. So tie up. So I'm being a little bit naggy here, but this is what you have to be presentable while you're at the clinic. So like them. So actually, I don't like this type of shoes because it's still considered a bit open in case of anything like glasses, needles fall on the floor. It might accidentally hurt yourself on your leg. Actually, it will be still better to wear a fully covered shoes. Okay. And again, stress this again. Don't be a reporter. Don't take notes right in front of the face of the owner. Do it subtly away from the owner or after the consultation. Don't bring in any reference books, okay? So act professionally when you're in the consultation room. Lastly, make sure help to clean up after each consultation, okay? All right, that's all from me. Any questions? Are you all clear?
Clear, Doctor.
Clear, Doctor.
Okay. All right, thank you. If Dr. Malaika is here, I'll pass the time to Dr. Malaika. Okay, I think Dr. Malaika is not here yet. So let me share with you all about the poster. So since I have a bit of time over here, so your poster assignment for your clinic rotation. So okay, again, can you all see my Padlet?
Yes, Doctor.
Yeah, Doctor.
All right. Okay, so for this poster assignment, so this is a group task. I want you all to prepare a one-page client education handouts. So this is to create awareness about the assigned topics with more on the preventive healthcare to the pets owner, to tell them the importance of healthcare and prevention for their pets. So if they turn out well, we might actually print it out and actually place it in the UVH or as a brochure for clients. So the titles, I have 10 titles. I understand that there are 20 groups. So each week there are 2 groups, right, per rotation. So each group will do 1 topics. So like the first 2 group 1 and 2, you'll be assigned the topic of vaccination for dogs and vaccination for cats, group 1 and group 2. And then this topic will be repeated again for group 11 and 12 later, and so on. So y'all can refer to the list over here. I'll put it in the Putra Blast. And here, this is just an example of an interesting poster. So you can make it into A4 size or A3 size using the PowerPoint. So let me know if Dr. Malaika is in. Oh, cannot see it. Try again. So hopefully you can open it later. So far, yes. So this is just one of the poster for clients, how to have a calm and pleasant veterinary visit for cats. So you make it interesting and informative for the owner. So make sure you put in citation for the information that you provide. Let's say you're providing figure, percentage, and some facts. Make sure you put in references and citation. All right. This is really, that's all from me. I'm done. Any question?
No, Doctor.
Okay. All right. I'm going. I need to go. So your please wait for Dr. Malaika. She will come in soon. Okay. Bye bye everyone.
Thank you, Doctor.
Thanks,
See you
Dr.
next
Chan.
week.
Thank you, Doctor.
Bye.
Since Dr. Malaka is not here yet, can I just ask the class, right? So for those that's next week you're gonna start your live surgery class. What of the class will be doing it, right? Um, uh, I think you'll be getting dogs. Do you know do you know how to actually like restrain dogs and then what anesthetic you'll be using?
We did once last semester, Doctor, with you.
Yeah, the lucky group lah.
That time we did.
The rest with I think next week group, I'm not sure. If let's say there is a mix of y'all, it will be good lah. So never mind. So what I can help you is actually maybe this weekend just kind of like put up. So you're expected to know how to use. So please revise on your ACE promazine sedation and then putting in an IV and then maintaining on the pentobarbital. So, and then if it's actually the animal is actually fractious, you can consider xylazine or xylazine together with ketamine. So those things you need to be you need to be revising. Okay. So, and then the other thing is you allocated 2.5 hours for GA and PrEP. So I think those who have not experience of putting an IV, you must grab the chance, arrange yourself that everyone in the group members, everyone in the group must have, like try to get in an IV, and then must know how to do your intubation. So that's what I can advise, because that's all, you only have that one chance, and that's all. Okay. All right. I see Dr. Malaika is here. Dr. Malaika, you
Hi,
can.
Dr. Chen. Sorry,
It's okay. You can go
I'm
ahead.
late.
Thank you. All right.
Okay. Let me unmute. 1 second. Can you hear me?
Yes, Doctor.
Yes, doctor.
Okay. All right. Assalamualaikum. Good morning. So I'm going to be briefing you on the Small Animal Medicine Board's rotation. So congratulations for being able to join the clinics and the wards. And I'm just going to run through with you initially what is expected of you in the Small Animal Medicine Boards, and then we have this set of instructions for DVM 4 and 5 before you enter the small animal practice of UVH. And I'm going to go through that with you next, okay? So stop me in between if you have any questions. Real briefly, what are the learning outcomes? So you're going to need to be able to describe the practices of the small animal boards by the end of your rotation. We want you to develop skills in animal restraint, perform a meaningful physical examination. So you should take this opportunity to practice your physical examination and observe sampling for diagnostic investigation, and then develop skills in nursing care. Okay, so general well-being of the patient, helping with giving medications. So these are the main things. So animal restraint skills, nursing care skills, providing that tender loving care, and then being able to do a proper physical examination. Right. So even though your rotation day is actually Thursday, you are required to come in for the whole week. And the reason we do this is that you get sufficient hands-on in the small animal wards. And you have to realize that when you are in practice, it's not just a one-day thing. You need to be able to take care of these animals throughout their hospitalization. Obviously, that's not possible, but at least for students, but at least you have that 1 week where you are taking care of the patients. All right. So you will be expected to come in for morning duty on Saturday and Sundays, and then night duty on Mondays to Sunday. Okay. So on Saturday, Sunday, you will be coming in at 8 a.m. and night duty will be from 7 p.m. until indicated by the clinician on duty. So you all know where the small animal wards are, and I am coordinating. However, we have all the small animal academics are involved in this rotation. So you have academic on duty schedule. I'm not sure if Dr. Chan shared that with you. Did she? Dr. Chan Wei, did she share the academic on duty schedule? Someone has to speak up because I cannot read your minds. Yes, no, maybe so. Can you hear me?
Can doctor? But
Okay. Was that shared with you, the academic on duty?
Dr. Chan not yet share the academician on the schedule, but it just
Not Dr. Chen, I'm talking about Dr. Chan Wei Yi.
yes,
Chan
yes,
Wei Yi.
Dr. Chan not yet show us
Okay,
the
all right.
schedule.
Okay, no problem. So anyways, you have this academic on duty schedule. So it's your duty to find out who is the academic who's responsible for you for that week. Okay, so it's going to be me, Dr. Intan, Dr. Kaur, Associate Professor Dr. Gaya, and Dr. Chanwei. Okay, so we're all involved in this. We all take turns. So you have to find out who is the academic on duty for that week because you're going to have to liaise with them. All right. Okay, I don't know if you guys are, it's not in a way a good thing to be the last one to present because your brains are probably very full of all the previous briefings. However, all this info will be on Putra Blast. So make sure that you read all this before you actually start your rotas, okay? All right, so what happens is the Friday before your actual rota starts, you are going to have to submit the last page of student instructions, which I'm going to go through with you in a short while. And you're going to receive cases from Puan Hasina via WhatsApp or email. Okay, so now we don't get you guys to come in to pick up your cases. It's just to avoid excessive traffic in the small animal wards, especially in light of, you know, recovering from the pandemic. Okay. Then in the evening, again, lies with Puan Hasina, not whether there have been any new cases on Friday. All right. Now, Sunday is the transfer day. So this is when cases are transferred from the old group to the new group. In the past, we had the old group and the new group work together on Sunday so that the transfer of cases could run smoothly. Again, to prevent too much crowding and traffic in the wards, we are getting you guys to do this online. So arrange with the previous group or the current group for the online case transfer. So it's up to you how you do this. I would recommend, you know, using some kind of Google Meet or something so that you can actually see the case and you can discuss the case and what needs to be done for the case so that you are well prepared for when you come in on Monday. Okay. So Monday, you will come in at night, and whenever you are in the wards, you are going to be working very closely with DVM 5. Okay, so the DVM 5 assigned to the case with you, you're going to work with them, and of course, the clinician on the case or on duty at night. Now, I need to emphasize here that you are going to help the DVM 5 in nursing care, restraint, obtaining samples, giving medications, and case assessment. At no time should you be handling the case completely on your own, right? So the main thing that we want you to do is, you know, learn first basic nursing care. So this is, you know, cleaning up the cat after you've force fed or coax fed. So making sure that, you know, you wipe around the mouth, making the cat as comfortable as possible. If there are nasal discharges, you wipe that off. You clean the cages, you provide the food, you provide the water. Okay, so that's what you're going to be doing. I don't want you to, it is not allowed for DVM4 to give medication on their own, okay, or do any kind of procedures on your own. You have to be supervised, okay, either by the DVM5 or by the staff. Okay, it can be an AVO or it could be an assistant veterinary officer, a veterinary assistant, or the veterinarian themselves or the clinician. Okay, so I want to emphasize this. You guys are coming in very fresh. You haven't had really the opportunity to come in before. So, you know, let's go slowly. So first learn how things are done, and then later on you'll get the opportunity to do it on your own. So this will go on Monday, Tuesday night. Wednesday, remember you are required to attend small animal medicine grand rounds. That is held at 8 a.m. every morning, not every morning, Wednesday morning. Okay, so it's a requirement for you to attend this. And then of course, again, at night, you will come in for your case. Which is your rotation day. From the morning, 9 a.m., you'll come in, sign attendance. And remember, you must ensure that you sign attendance at all the stipulated times. So at night, you come in 7 p.m., make sure you sign attendance. If you forget to sign attendance, you're considered absent. All right. So even though you come and say, no, I was there, this person can vouch for me and all of that, I'm sorry. Your duty is to come in and sign attendance first and then get to your cases. Okay, so you must remember first thing when you are making your way to the small animal wards is attendance, attendance, attendance. Sign that attendance, okay? All right, so 9 a.m. you come in, you're going to follow the clinicians in the small animal ward, see practice, help clinicians, okay? And then when you can, obtain those signatures for your CPP. From 12 to 1, what I've put here is that you will actually perform skills. We're going to list, basically it's PE. You're going to do a PE on a cat or dog in front of the academic on duty, and you also calculate IV fluid as instructed, okay? Now I put here 12 to 1, but it really depends on the academic on duty. That's why I've said you need to identify who it is for that week and liaise with them, because you need to find out when is the best time to meet them. Now they may meet you online, so they might actually get you to do PE virtually, I mean on like just through the webcam, or they might meet them face to face, okay? So talk to them, email them. And 2 to 5, you'll continue as is in the morning. Now I've written 2 to 5, but you might go on 2 to 6:30. You know, you cannot say, oh, 5 o'clock, I'm out of here. Okay, so you really, when the case needs to be settled first before you make your way, you know, to have dinner or what have you. Okay, remember that. Of course, all the clinicians know that, you know, you have night duty, so they will provide you at least half an hour before your night duty starts so that you can eat, have your dinner and rest a bit. Okay. And then Friday are the small animal surgery rounds at 8 a.m. So please do attend that if you know, that's also compulsory for you to attend that. And continue case management at night. Saturday and Sunday, you will come in at 8 a.m. Okay, so you're going to help DVM5 with management of cases. And you may or may not need to be there during the afternoon, but if a fluid ICU or fluid rotation is you may need to be part of that if that's scheduled. Okay, and then again, night treatment for Saturday, Sunday. Now, the Monday, the following week after rotation, you're going to submit your case log to the unit coordinator, and that's me. And you're going to submit the CPP to the academic on duty. Okay, so they need to verify and see if you actually manage to when you're in the wards. Okay, so a couple of notes. One, you will be expected to work closely with DVM5 with the DVM5 student assigned to the case, and any medication or treatment or procedure must be done together with the DVM5. Don't attempt to handle cases without supervision. Very important. 2, all students on rotation are required to be present at all times stated, except when there's an asterisk. And if you do not have a case, you are required to help your group mates with their cases. Okay, so this one, if you do not have a case, you're required to help your group mates. Well, we did that in the past, but now what we're trying to do, because the groups are kind of big, so we want to try and avoid too many people too close together in any one area. So this one doesn't apply anymore. Okay, so what you want to do if you don't have a case, ask first the clinician. Okay, ask the clinician what you should do, which case you should help with, so they can identify, you know, areas where maybe there's not such a crowd, and you can go and help in that area. Okay, so don't just simply go wandering around to different units. We don't want that. Okay, or different rooms. So for example, just wandering into ICU to see what ICU students are doing, don't do that. Okay, we discourage that now. So if you have cases in the cat wards, just remain there in the cat wards. If you have cases in the quarantine, you know, stay there. Don't be wandering around too much. Okay. 3, assessment of clinical skills will take place on Thursday, again, between 12 to 1, I've written here. However, it may change depending on the academic on duty schedule. So contact them, but via email only. So please do not WhatsApp them. Please respect them. You know, they have a lot of other work, and they have numerous WhatsApp messages streaming in. You don't want to add to that. Okay, so just email them, they will reply you. But when you do email them, make sure you email the Rota group, your group, and the date of rotation, and email them quickly. So, you know, before, email them by Monday at least of each rotation week, so that, you know, you can set a time with them for that week you're on Rota, right? So attendance is compulsory and 100% attendance is required for this rotation. If you're sick, what do? Call in. Okay, so what you have to do is first you have to make prior arrangements with your friends. Okay, so in your group mates, let them know that you're sick, you're not going to be able to attend, and identify which group mate will take care of your case in your absence. Okay, when you come back, immediately submit a sick leave certificate to the teaching academic on duty for that week. Okay, you'll be allowed to replace what you missed at another suitable time. If you're absent for any other reason, you have to submit a written letter to the teaching academic on duty for that week stating reasons for your absence. Now, you may be allowed to replace only if the reason is deemed valid. So replacement is not your prerogative. Okay, so if you had to attend somebody's, wedding, okay, and you took leave for that, okay, that's not a valid reason. So you may be considered absent, and if you're considered absent, you haven't achieved the 100% attendance, and you will have to repeat the rota. Okay, so be careful. If, for example, it's a wedding of your sister or a very close family member, of course, you should know about it much earlier on. So you need to discuss that with the academic on duty before, so that they are aware and you can make arrangements to replace if they allow you, right? So make sure that if you know that you'll not be able to attend for a good reason, you make an application writing to the clinician on duty for the week you're on rotation, and make sure you notify them way in advance. Okay, if you know, I mean, if it's your sister's wedding on that Thursday, or let's say even Saturday, all right, and you need to attend the wedding, you don't inform your academic on duty or teaching academic on a Friday or a Thursday, right? Because obviously that date has been set way before. So make sure that if any such occasion arises, you inform them in advance. So how are you being evaluated? Okay, so 30% of evaluation is based on attitude. So that's a big chunk, right? So think about it, guys. Just being punctual, showing teamwork, being active, anticipating, being helpful, all of that, can give you just 30% of that 100%. Okay, so that's a big chunk of your final marks. So have a good attitude when you're in the wards. This is a learning experience for you all, and we want to make the best of it, and you should try and make the best of it too. Okay, knowledge is 20%, so you haven't been through diseases, canine, feline, medicine, etc. So we don't expect you to have detailed knowledge in terms of diseases, but at least you should be able to understand the basics of disease based on your clinical medicine lectures. Okay. Clinical skills, 35%, case log and CPP, 10%, and rounds attendance, 5%. Okay. Now, just to reiterate, the 8 reasons for automatic failure. So these are reasons for automatic failure. We are not going to, we are not going to cater to any kind of whining or trying to get out of this, because we have made it very, very. One is attendance is not 100%. 2, giving your opinion and talking to clients about the case without prior permission from the clinician in charge. So you are not allowed to talk to the clients. I mean, of course, you can say, hi, how are you? And they say, oh, how's my cat doing? And you can say, oh, he's fine, but you should talk to the vet on the case, okay? So I'm not saying just when they say hi, you don't even reply them, but you're not allowed to give opinion, or say, oh, we did this and this is what we found. You're not supposed to talk about the case with the client. Okay. 3, duplicating, photocopying, digital photographic capture of UVH documents and records. So whatever things you want to note down from the case files, you must do it in writing. We do not allow it. That's all private and confidential, these case files, so you're not allowed to take pictures. Okay, now let's say you are sharing during case transfer, you're sharing these pictures of the case file. You may be doing that at that moment because now things are online. So that's one exception, but I do not want to see any of those case files or any part of those case files being uploaded on any kind of social media or any blog, etc. All right. So really, it's confidential. If you need it, jot it down and erase those photos. All right. For any form of plagiarism, 5, failing in the attitude section of the evaluation, and this has happened in the past. So not being punctual, trying to get away from work, being absent when you should be there, or just MIA. We're looking for you and you're not around. Those kind of things could actually lead to an automatic failure. Changing treatments or starting new treatments without prior permission from the clinician in charge of the case, performing procedures without supervision, and instituting medications wrongly. So if a subcut formula was given IV, you will, by mistake, it was a mistake, I don't doubt it, but you will still fail, okay? Because some mistakes can be deadly, all right? So really, giving a subcut formulation IV, you could kill the patient, right? So some mistakes, are not forgivable. So you have to be very, very careful. Double check everything you do when you're in the wards. Okay. Now we have these instructions to in Form 5 for further information. I'm just going to highlight a few key points because I don't want to overwhelm you. So are there any questions first with regards to this synopsis?
Doctor,
Yes.
we just my group just wanted to confirm, since we're going to do the first
Yes.
rotation for ward next week, so does it mean that our group will start this Monday?
Oh, okay. So you are the first group. You will then, yes, you will start on Monday. So there's no case transfer for you. Okay.
Okay, so
Hello, can you hear me?
yeah, so meaning that we'll get the case on Monday itself? All right.
No, what you do is actually by this Friday, by tomorrow, you should be assigned cases already. So liaise with Puan Hasina for your cases, and then you come in on Monday.
All right, Doctor. Thank you.
Dr. Malaika, how do they
Okay.
liaise with Hasina? The email?
Email, and then she usually is okay with WhatsApp, but if they could first email her, and then she usually is willing to share her number. But first email her, and then you can continue from there, whichever method she prefers.
So the student, do you know her email?
No, Doctor. Right now we don't have the email.
Yes, Doctor. I will pass to them.
Okay. Thank you.
Okay, let me get you her email. Or let me just ask her whether you can contact her directly via the phone if she's okay with it. Okay.
Dr.
Any
Malaika, I'm
other
not sure.
questions?
I myself have a question because I
Yes.
don't recall Dr. Ong or you actually saying, because are the students, all 12 of them, come in on Monday night? All will do treatments, or they will take turns, or how? That was not, I think, was not highlight as well, how they will arrange themselves and how.
So by right, the 12 can come in at once because what we are going, that's the way we have asked that Puan Hasina actually um, assign the cases. So for the medicine wards, at least, I'm not so sure about surgery, but because medicine wards, we have divided into quarantine, cat medicine, and dog wards. So in that way, we ensure that, it's three, there's four students in each of those areas. So that's how for medicine, all the students can come in at one go at night. So we want, but again, another issue is that if there are not enough cases, those students without cases would not need to come in.
Okay. So meaning is if
So
they
I
are
will
not
again,
assigned case,
yeah.
then they don't come in.
If they're not assigned case, they won't come in. Yes.
Okay. Thank you.
Okay. Thank you, Dr. Chen. Any more questions? Just hang on 1 second. Puan Hasina's calling me so I can ask her immediately. Yeah. Okay. Hello.
The
Okay. So Puan Hasina actually is not around for the next 2 weeks, so it will be Mr. Firdaus who will be assigning cases for the two groups. So I will, if who was saying that the leader of the group coming in next week? Can you just contact me personally, and then I will give you the information in Mr. Firdaus's contact. Okay.
Okay, thank you.
All right. Any other questions? Okay, so I'm going to share with you, second, the rubrics. Share, stop sharing. Okay, so this is the rubrics. Just make sure you fill out all the top and you hand it into the lecturer on duty or the academic on duty on the Monday of your rotation week. Okay, so what, again, just to show you the breakdown, clinical skills make up 35%, CPP total is 10%, and then knowledge 20, attitude 30. Okay, so this is 95%, and then of course 5% for the rounds attendance. So what I want you to do is ensure that you provide this to the academic on duty, so your names will be here at the top, your group members. Okay, so put your group number, and then the student will fill up the names at the top here. All right, and last but not least, I'm going to share with you the instructions. Okay, the instructions are quite long, so I'm just going to highlight the most important points, but I do want you to read it thoroughly before you actually start your rotations, all right? Okay, so this is instructions for all small animal clinical rotations, okay? And it is just basic information that you should know before entering. Remember, it's this small animal practice is an area of high activity. You're dealing with lives of pets that have been entrusted to UVH. So really, we require full attention to avoid any mishaps. And your behavior and conduct will reflect the small animal practice of UVH and of the faculty. So, just make sure that you're on your best behavior. Okay. So you may be aware of some of these instructions. I did talk about some of it, but I am going to highlight the most important parts. Make sure you read it thoroughly before coming in. I repeat myself here. All right. So instructions, you already know, settling in the wards. This one, just go through it. Evaluation of patient. You're going to be evaluating patient with a DVM-5 daily. Okay. Some things that you should remember is when you're walking dogs, you are to walk the dogs in the run area for defecation, urination. It's not an exercise time. Okay. So don't start running around in that run area with the patients. They're patients, they're sick, they just need time to relieve themselves, not for long walks or exercise. Okay. Make sure that you walk the dogs on short leads or chains. Don't let them run loose in the run. Okay. And all feces, scoop it up and dispose of it appropriately. Don't just leave it on the grass. We don't want a poop run. Okay. Records, don't worry about this at the moment because you will not be writing in the SOAP at the moment. Most to most, probably, you'll be writing the temperature, pulse, respiration, and ABU. But in terms of other the assessment, the DBM-5 will be responsible for that. Okay, so remember again, records are confidential. All right. Off our duties, just remember that we want to ensure that all of you are safe as well. So you're not allowed to be alone in the wards. Okay, just remember that. Don't be alone in the wards. There must be at least 2 students around at any one time. And this is the same for night duty. Okay. Your emergencies, I've given you the phone number of the wards. You need to call in, especially if you are not able to come in for any reason, especially if you're sick. And this is Puan Hasina or the reception counter's number. You should call that first. And if you can't get in touch, then you can always email, or if the academic on duty has shared their phone number, make sure you contact them that way. Okay. All right, off-hour clinicians, if you're on off-hour duty and you need any clarification, then you need to contact the clinician on duty. So they will provide their number or the way to contact them. But remember that this should never be given out to clients. Okay, so the clients may come in to visit when you're around, but remember, even if they ask for the client's number, the veterinarian officer's number, do not hand that over to clients, okay? Telephone numbers, you must exchange telephone numbers with each other in your group. And also you need to print out your numbers and place it on the whiteboard in the ward. So if we need to contact you during the day, we are able to do so, because it's happened in the past when a student has forgotten to tick the TPF, which is a treatment plan form. So we're unsure whether medication was given or not. And we've had to corroborate with the student on the case and call them up. Okay, so you need to make sure you leave your numbers with us. Okay, for recumbent patients, these patients require special care. So, this is, again, read this. This is about providing that special nursing care for these kind of patients. Okay, so we're looking at that, whether you're providing that nursing care, and we'll observe, the patients following you being with them to see whether this is being done. 4th year, okay, this is for you guys. This is a reminder to DVM-5 as well, that you're going to be working with the DVM-5, and we remind the DVM-5 that they are responsible for you to a certain extent. Okay, so they they must oversee what you're doing, because if something goes wrong, then they are the main person or student responsible for the case. So the the responsibility lies on their head. Okay, so that the responsibility that things are done properly. Okay, cases, surgery and medicine case list form. There's a list form in the wards of all the medicine and surgery cases, and you must keep an eye on that list to see whether cases have been assigned to you as the week progresses. Okay. All right, so case responsibility. All right, the case responsibility basically, there may be 2 students assigned to a case, but there is to be a primary person, and this person is totally responsible for the case. All right. Remember, the new group of medicine students is to officially take over on Monday. However, if Monday is a holiday, the old group still has to continue with the case ownership on Monday, and the new group will be officially on Tuesday. So this has happened many times in the past. So remember, this is what we practice. So you shouldn't need to keep asking questions about why does the old group still have to take care of the case on Monday? This is a rule, you have to follow it, okay? Case transfer to ICU or surgery or medicine, students on the case remains responsible for the transferred patient until the new student in that unit is assigned to the case. So it's not like, oh, my case went into ICU, I don't have to worry about it. So until there's a new student assigned, you will have to be responsible, work with the clinician on the case and ask them whether your assistance is required. Okay. So expectation of the new group, when you do come in, you have to do a full physical examination on your patient that you've been assigned. Okay. So this was done on the weekend. Now you're not coming in on the weekend, so you must do it Monday. Okay. So security, again, make sure that you're always present in twos. You're not to bring in outsiders, friends or families or visitors to the wards. I'm sorry, okay? You must make sure that, just because you have a friend visiting that night and you want them to see what you're doing, sorry, that's not allowed, okay? Keep the main door locked. And when you're handling patients, make sure the exit doors are closed. We've had cases when cats and dogs have escaped. You don't want to lose your patient. All right. If there is a runaway, what do? You immediately get a groupmate to notify the VO or AVO, and you gather others to form a search and rescue team. Okay, that's why it's very, very important to never leave your patient unattended on the table. You think the cat wards is very secure. There was a cat that escaped, jumped up, and managed to squeeze through the grill of the window on the very top, and it was very difficult to catch that cat later. Okay. So medication, remember, you're not allowed to change any medication without prior approval by the clinician in charge of the case. Okay, unscheduled visits by client during off hours. This is not supposed to occur, but if it does, do the following. If the clinician on duty is not there or off-hour duty is not there, just be courteous, tell them that you're a student and tell them that, leave their name, number, and their pet name, and you will ask the vet on duty to contact them when they can. Okay. Under no circumstance are you to give your opinion on the case, okay, or speak about the problems of attire. You must wear smart clothes. We don't allow jeans. We don't allow sweatpants. Because the reason for this is really, we have clients coming in the wards as well. So we just want you to be looking smart. So make sure that you are not you don't have to wear a collared formal shirt and all of that, but you should look smart. Don't really wear skirts. They're not the best when you're working in the wards. And don't wear sandals. Okay, so you've been forewarned. There have been times when students have been sent home because of poor attire, like frayed pants and things like that. Okay, so please. All right, I think that's about it. Okay. Okay, the rest just have make sure that you go through all the information here, because we have an SOP for the students undergoing clinical rotation. So we're making sure that we're monitoring your temperature, if you have any flu-like symptoms, of course, don't come, okay? And just ensure that you don't move around too much in between units, okay? We're trying to limit the number per unit, so please follow that. Don't go roaming around unnecessarily in the small animal practice, okay? So just read that. And again, the reasons of automatic failure have been reiterated here. So this is a portion that I need you to fill out and sign and submit before entering the small animal rotation, okay? So you are required to submit one copy upon entering any small animal rotation, whether it be ward, ICU, surgery, anesthesia, radiology, clinic. So you don't have whichever one you enter first. But remember, guys, please read it in detail. I know it's not the best read, it's not a fun read, but it's very important that you read it in detail before entering small animal practice. Okay. All right, so that's it from me. It took, sorry, this dragged on longer than I hoped. Are there any questions, comments, queries? None?
I think
Okay,
just
great. If you do have any, you want clarification for anything, you can always email me. Okay. So with that, I guess I'll end. Have a good time, right? Enjoy your rotation. It's, this is the time you get to really work with those, take care of those patients, work with those pets. So enjoy your time in the wards. Okay. Thank you very much, Dr. Chen. I'm done.
Thanks, Dr. Malaika. Okay,
Thank you,
students,
Dr.
do you
Chen.
still have, yeah, thank you. Do you still have further question you want to ask about the rotation?
Hi, Doctor.
Yes, go ahead.
Yeah, our group has a question about anesthesia station for next week. So we're wondering which place should we go? Is it are we working together with the surgery rotation or?
Okay, has Dr. Obey contacted you all that he would be arranging a discussion with you all or a briefing? Nothing.
As far as we know, not yet.
Okay. In that case, I will remind him. Maybe he have forgotten too many things or come up because he said he's arranging himself. So I will remind him that he had not had a session with you all. And actually, like the arrangement would be at least, I am not sure. So that means actually like at least for next week group that is going to small animal surgery. So based on Dr. Ong's arrangement, the group that will be going next week into OT, you will have an orientation. Your orientation is this Friday, right? That's what according to Dr. Ong. So the group that will be involved, if you are not sure, then please reconfirm with Dr. Ong what is the time, and then I think it is either Encik Adam or Encik Rahaizat that will be giving the briefing and what is the time. I think my recommendation would be this way, because when you come in on Thursday, itself, it's actually like things kind of like already start, like 8 o'clock, we already start working and so on. So by the time you come in at 9 o'clock, like things already like moving. So may not have time to brief you. So my suggestion is actually and I will also write an email. I would suggest that the next week surgery group and anesthesia group students to have your briefing on this Friday, but you cannot go in all, like all 24 of you at one go to the OT, so have to make arrangement so that certain number of people that need to be go. So I leave it to actually like the group that's involved to make arrangement for the briefing where you go into the OT and get familiarized of like where things are kept, how things are kept and so on. So you have more time on this Friday, okay? And usually Friday afternoon, it's free, and the OT is free for you to explore. So I think that would be the arrangement. In terms of what expected, I leave it to Dr. Ube to actually like brief you. So basically, it's actually also to follow the whatever workflow it is. But the main SOP that I can remember saying is that not everyone will have the chance to get in the OT. So you have to actually like take turns on actually like getting the OT. And this applies both to small animal surgery students as well as anesthesia group. At any one time, probably one OT only can take in, I think not more than 4 or 5 students. So you all have to actually like like teamwork, communication, and actually like see how best to actually like some people get to go in and then some is supporting in the ward because there are so cases in the ward that need to be actually monitored and worked out. And then those who have actually like help and still available then can get into, there is actually like the corridor, the hallway from student surgery, if you explore and just walk further up. So there's actually like a space between the small animal surgery and large animal surgery. From that hallway that you can peep inside the main OT and see like when cases are ongoing. So sometimes when cases are going with anesthesia, like there may be things that is actually happening in the OT, and then the NS or the vet that's attending may just write something and actually like try to keep you update of like what's going on in the OT. So that's the best that we can do lah, okay? Because obviously we can't have everybody going to the OT. And then what other things? So usually they would probably arrange like the discussion and so on, but when that will be, it really depends on the caseload, depend on the time of the attending anesthetist. So they may actually like arrange a time to have discussion with you all. Okay, so I will remind that, but at least like this week group, can I just actually like CC that to the class? So whichever group that is actually like involved for next week, then make the detailed communication from there lah, with either Encik Adam or Encik Rohaizat from OT in terms of the orientation for this Friday. Is that okay?
Okay, doctor. Thank you.
Okay. The other one would be, oh, okay. So just now was talking about the 3712, where quarter of the class will be having the practical next Tuesday. So I was actually like trying to emphasize that you also have to take the opportunity and making sure that at least you have, like try and put on a catheter, and also to try to put the endotracheal tube in correctly and actually like inflating it and then taking it out, and then have your friends actually like try that. So meaning if somebody tell you previously when we actually read the role, we were saying that while the anesthetist and the surgeon or the assistant are working on the animal at the prep area, then the assistant surgeon to scrub in first, and the the OT nurse go in and actually open packs. So perhaps that need to be changed a bit. You can open packs and actually like get ready, but assistant surgeon probably shouldn't actually like early scrub in and then get sit in, because that one practical is your only chance to actually work with the live animal. So if you have your pack open or whatever, then the rest of the group members should be out there, have the opportunity to to learn how to handle the animals, right from actually sedation to at least put in an IV catheter and see the process of induction and all that. So those things is something which if you miss it, you miss it lah. It's just too bad that that's actually like no time to arrange that anymore, and you have to grab the opportunity when you come to clinics. So I feel sorry for you. You will have a lack of so much of this hands-on on handling animal, and those are very important. So you have to work as a team and see how those, like last semester, I think at least one group have the opportunity to handle. So I think you learn a lot from there. So give opportunity to those who have not had experience handling the live animal in terms of actually doing the sedation and doing that part of placing that IV when the animal is just slightly sedate and induced with the pentobarbital. Okay, and then if you have a very uncooperative dog that you think using acepromazine at 0.1 milligram per kilogram will not help sedate the animal enough, and they'll struggle with you. So consider using like xylazine at it has a wide range. It can range from 0.1 milligram per kilogram to 1 milligram per kilogram. So there is a range of that xylazine dose. So sometimes just xylazine alone can sedate the animal enough, but if you want to be, like even more for really very anxious and potentially may actually like be turn fractious and bite you, then you add on like ketamine in it. And again, ketamine can have a range from 5 to 20. So if you are using like, xylazine 1 with ketamine 20, that is considered like this is typical the dose regime that is used. Once it's given to the animal can go into general anesthesia in less than 5 minutes. And in fact, this is what you'll be using, everyone is using, in fact, in Malaysia, if like we want to do things like spay or castration in cats and dogs, both can be done. Okay, so sometimes like if castration, we don't even go to such a high dose. We probably just actually like get by with 1 xylazine and 10 to 15 ketamine, because we do not want to have such a prolonged anesthesia for such a short procedure. But if OHE, yeah, probably start with 20. And if you're very good, some people finish OHE in 15 minutes. And that kind of like protocol is actually like enable that kind of like work being performed. But if you actually like need more, then we add on another half, or sorry, 1/3 to half of whatever we use for induction is safe to as a top up. So, and that's actually like the typical protocol use if we don't have, things like anesthetic machine, we don't have get access to more expensive drugs. So those were the practical field anesthesia that consider basic lah to learn. But because in your practice on practical, it's going to take the whole day. So we also want you to have experience of knowing how to maintain the anesthesia. Unfortunately, we may not have enough xylazine ketamine for you to continuously top up the animal, because we know that, like your dose of xylazine 1 to ketamine 20 probably only lasts you half an hour. Okay, and the animal in less than half an hour, they're going to show sign of like slowly they're going to show sign of recovery. So to maintain your animal from 10 a.m. until you finish at 8 o'clock at night, it's going to be so long. Sorry, we don't have enough of the anesthetic. So the cheaper solution we have for you is to use pentobarbital. All right, even the pentobarbital is the diluted one. I think I mentioned before to the class. So the pentobarbital use, just have to bear in mind, this is it's meant for your practical, because the pentobarbital is diluted from the more concentrated pentobarbital that is supposed to use for euthanasia. That's why the solution looks pink color, because they put in the dye to show how dangerous. I mean, like, it's a dangerous that actually we take caution when we are handling this drug. So this drug actually, the concentration as 180 milligram per mil is supposed to meant for euthanasia. So we dilute it to 60 milligram per mil, so that it's easier for you to titrate and use it as an anesthetic, not as not as a euthanasia agent, but as an anesthetic. So it's actually in a more diluted form. And we use this because this animal that is used for your practical is not meant for recovery. Once the animal go into GA, you're supposed to maintain anesthesia. If you can't maintain and your animal recover halfway in the practical, sorry, I have to recommend that the whole group get fail for this. all right? It's a welfare issue. You should learn to actually maintain your animal under GA, and at no time should it be allowed to experience suffering or pain, recovery because you were doing surgery, all right? So, so in terms of this, it's actually like, that's why we are using pentobarbital, because the animal are not expected to recover from GA, and we just maintain until, if you're good, you're able to maintain for many hours until the end of the practical class. And then you will inject more pentobarbital to and to euthanize, humanely euthanize the dog. Okay, but some of it, the animal also are not well. They may have underlying disease. So sometimes the maximum that you can maintain maybe only for whatever couple of hours, depending on how good you are to recognize the um, uh, abnormal physiological changes, and you're able to correct that and be very meticulous and very careful with the way you titrate your pentobarbital. Some of you may be able to actually like maintain until, like you really to the point that we ask you to euthanize the animal. So that's mean that actually like the anesthetist is doing a good job in actually like really monitoring the animal very well, and accustoming, titrating it just to the effect that you want. Okay, so to me is actually like that is your learning objective, and you should target to do that. Okay, maintaining that animal until the end of the practical class. But if you can't, we also understand, because some of this animal may have underlying disease. But if within the first hour of anesthesia, unless the animal is very sick, which you may get, but if it's not, and your animal is because of your carelessness, and your animal die within the first hour of GA, then sorry, like I think you also not competent, in a sense of like you did not even read and be very careful with your titration technique. So, and did not actually like take note of like certain things that require immediate action and so on. So that's why in actually like making sure that you can have a successful practical session, you really need to be prepared, read all the notes that you can, and if you still have actually like things that's not sure, then always can compile your questions, and then and we'll try to actually like answer your questions. Okay, that's the advice I can give lah for you. All right. Mm. Another one is actually just now we mentioned that if the animal is fractious, and therefore you need to resort to using xylazine ketamine. So bear in mind again, if you have used xylazine ketamine, meaning you have something more, anesthetic that is actually have some more profound depression effect on the CNS. So when you do your titration with the pentobarbital, you need to be even more meticulous and careful compared to ace-promazine. Okay, because I usually tell you that ace-promazine, your degree of sedation is probably only mild sedation. If you use xylazine, it can go into profound. If you use xylazine ketamine in the GA dose, your animal actually go into GA. Okay, so but again, then once you go into GA, depends on the interval from the time that you have given the drugs to the time that you have established an IV access and ready to give more pentobarbital. Then the amount required to further deepen the anesthesia again varies. So that's why there's actually doesn't have a fix, like exactly what dose to use. And therefore we teach you that the principle is go back to titration to effect. Okay, so the titration to effect, and this can only be done if you have a IV access. So that's why we teach you that get the animal sedated in such a way that you can restrain, so that you can place an IV, ensure that it is a real IV and not subcutaneous, so that when you give the drug, you will immediately able to assess the effect of the drug that you're given intravenously, and from there, slowly given in incremental dose, just to the point that is just right, which is stage 3 plane 2 or plane 3, and not beyond that. Okay, so that's my advice for your practical class. Is that okay?
Yes, okay, doctor.
Yes, doctor.
Okay. All right. So time for lunch. Shall we end here?
Okay, doctor.
Thanks for all your attention. Have a good lunch.
Thank
Take
you,
care.
doctor.
All the
Thank you,
best for your
doctor.
exam as well.
Thank you, doctor.
Bye.
Thank you, doctor.